All right. Let me start sharing my screen. All right, cool. So hello, everyone. Welcome to today's APAC community call. So let me share my slides really quick. Oh God, I'm so sorry. The laptop just decided to not work, which is fine. We're gonna start with, so of course we're gonna start with the Odyssey news. So for today, we really want to kind of just do a quick news on ourselves on the odyssey.org/APAC page. So I know most of you probably have been using this website, and you probably have already noticed that we've made some updates or a lot of updates here on the top part of the page. So now I think it's really, we want to make sure, we have our Odyssey APAC community call schedule here so that, every time people come in, they can see kind of what's going to happen next. And I know we do have a bit changes, which will be updated soon here, that the next one will be about cohort diagnostic tool from Gotham. And so that we will be changing the community call, but overall, just a high level kind of preview of what's coming up for all of the biweekly community calls. As well as we do have kind of some introduction and also contact link of the 2022 APAC studies, which we'll be hearing about in just a minute. So that's everything here, just so that we do have all the information. And again, want to give a shout out to our APAC study liaisons, where we have the media team link. And then, of course, we have all of the past APAC events links that you can always go to, as well as the regional chapter updates. And then if you scroll down, all of that are just by all of the recordings, the material links for each of our APAC community calls starting last year. So just want to let everyone know. So this will be our kind of central page of all of the information you need for the APAC communities. And always stay tuned. We'll be kind of posting kind of new updates for the community calls and all of the news here. Cool. So that will be my part of the Odyssey news. And then we will be talking kind of really now that I have the page open. So today is our kind of quarterly update for all of the four APAC studies. So we'll have Chen and Hong Kong U team and Chungsoo to present the quarterly update. So unfortunately, Nicole about the multiple sclerosis study. So she is out of office or on leave during this week, so she won't be here to talk about the search study, but definitely we will catch up with her or let her share the progress later on. So we'll have three study updates for today. So with that, I will stop sharing and I will be inviting Professor Seng Chan You to talk about the study update on the characterization of non-communicable disease across pre or after COVID-19 era. Yeah, I can see this slide. Thank you.
Yeah. Hello, I'm Chan, and I'd like to briefly address the update on today about the chapter study. The full name of chapter study is Characterization of Health by OHDSI APAC chapter to identify temporal effect of the pandemic. You may forget the study, so I'd like to briefly introduce what this study is and why we do this. So during the COVID-19 pandemic, the resilience of healthcare system has been heavily challenged across the world. And in the previous studies show that there is abrupt drop of certain phenotypes in the databases, and we can estimate or expect that these abrupt drop may be cause the later burden on our healthcare system. So in this study, using UK database, they found that some certain conditions such as diabetic emergency or acute cardiovascular events were decreased during the COVID-19 pandemic. So just like that, we want to estimate the numbers of these certain phenotypes across the APAC and OHDSI network before and after pandemic. And we gathered the study list from Australia, Japan, Korea, Singapore, United States, and Korea. And they want to calculate the numbers of the phenotyping regard to residential care or hematologic disease, cardiovascular disease, diabetes, cancer, or allergic disease in children. So again, we will calculate the number of incidence, prevalence, and the counts for these phenotypes of the study list in the study list. We will calculate these numbers monthly before and after COVID-19 seasons. And later, the temporal pattern can be analyzed by using statistical methods such as interrupted time series regression. After the first meeting, we deployed the Atlas instance for the study, so you can use the Atlas for dedicated to this study by using this link, and you can see that several folks already created their own cohorts. And we reviewed the recent OHDSI benchmark study. It was the phenotype February. In the phenotype February, the OHDSI members created a bunch of the cohorts, and we can see that their temporal patterns or the features of cohorts. So we can see which cohort can be reliably used in this study too. And we review how to calculate incidence and prevalence in OHDSI network, thanks to Jing and Patrick. And we discussed about the temporal causal inference. After we need to estimate the temporal causal inference after gathering all these numbers. So but we do not have a concrete conclusion for how to draw the temporal causal inference after we agreed in the numbers. Not yet. So in the dedicated Atlas instance on GCP, you can see that several folks has already created the course, and they has some experience on this site. And the plan of mine to submit the results to the OHDSI symposium, that first I need to create the skeleton package for chapter studies to cover the sub-studies of the list. I will create this skeleton package based on the core incidence package, but I need to modify this package to calculate monthly incidence. Currently, this package only provides a annual incidence thing, and we will start pilot study using the core definition from the phenotype February. That's all I prepared. If you have any comments or thoughts, please let me know.
So I have a question, Chan. Like, based on the discussion with Patrick, did you guys find that for your study you were using the right analysis when it comes to incident rate versus incident proportion versus prevalence?
Yeah, that is a really good question. So based on that discussion with Patrick, we found that there is a difference between incidence rate ratio, and prevalence, especially in the OHDSI schema. So that's why I create. Before that discussion, I thought that I can use the core diagnostics package because it also provides some similar modules for temporal incidence. But after the discussion, I changed the base package from the core diagnostics to core incidence to calculate the incidence more accurately and properly. But again, still, I need to modify this package a little bit more to calculate monthly incidence. And I can do that.
Awesome. So for those who doesn't, maybe who weren't part of it, what happened was we asked Patrick to give us he gave us basically a lecture on how what was the difference between incidence rates, incident proportion, and prevalence. That was this week, and we're going to put that recording out there for folks who missed it to listen in. And I think it may be a good opportunity for folks to really understand the difference, because like Chan said, they used the wrong one, and we didn't even know that. I shouldn't say he didn't pick the wrong analysis. He picked the wrong R package to run, right? Because he mentioned that he thought it was in the Cohort Diagnostic tool, but there is actually a different place to run the actual incident rate for I think it was yesterday, was those that are chronic diseases, because you're constantly going in and out of the cohort. See, I'm trying to remember my lesson from the other day. But it may be something that folks might want to look at, because it was a very interesting lecture that he provided us with.
Yeah, indeed. Thanks for Patrick, and thanks to the Jing who coordinated that meeting. So, any other comments or thoughts?
So Chen, when will I guess, sorry, I was just thinking, I know for the European Symposium, the abstract is due on May the 6th, I think, and then the global one is due sometime in June. So do you think that's something the study will be, marching towards, or?
Yeah, I need to struggle to submit to those symposiums, but yeah, because it was really helpful, because that we do have the core instance package, and we do have the previous work for core diagnostic core phenotypings, which occurred in this February. So by combining these two, I think I can just make some feasible results.
So will that be only kind of the data from your organization, or we could have potentially some runs from other data, like not from your own?
So as you know, I think I can submit the abstract by using only Korean data, but we can do something from the APAC network or the global OHDSI network until the actual European symposium or American symposium.
Okay, yeah, because I mean, like, if time allows or the package is ready, we can definitely run that in QVS data, or reach out to other APAC data partners to try to actually give it a try if we can make it on time for either symposium deadline, abstract deadline, I guess.
Yeah. Yep. We are on the race now.
We're all on the race now.
I just have to say, for the US one, you don't have to have the full study done.
Right.
You just need the concept, and if that's the one you're targeting, then having just the Korean data in there for the concept should be good enough. And we just have to say, hey, we're still running this for the rest of Asia Pacific.
Yep, indeed. Okay, cool. I think I can turn into the next study.
All right, so just want to make sure, any other kind of questions from the audience on the chapter study from Chen? Okay, cool. I'll take that as a no. Thank you so much, Chen. And then for the next study, we will be talking. We'll have Ivan from Hong Kong U to give us an update on the comparison of mortality, morbidities, and other kind of healthcare utilization for folks with or without a diagnosis of COVID-19. So also around COVID-19. So Ivan, I was wondering if you could share your screen.
Yeah, sure. Just one moment.
Thank you.
Okay. Hi. Can you guys see my screen?
Yes.
Thank you. Yeah. So good morning and good afternoon to you all, and thank you, Jing, for the introduction. My name is Ivan from the Hong Kong U team. Yes. So I'm just gonna talk you through well, just give you guys a reminder and some updates on our study for the APAC OHDSI APAC Study 2, which is on the comparison of mortality and morbidities and healthcare resources utilization between patients with and without a COVID-19 diagnosis. First of all, just some quick reminder on the objectives of this study. We aimed to monitor and evaluate the short, medium, and long-term mortality and morbidities following COVID-19 infection, as well as the short, medium, and long-term healthcare resources utilization following COVID infection. And thirdly, we aim to investigate the adverse outcome of COVID-19 in specific populations, including children, elderly, and patients with multi-morbidities. And this, if you can see from the timeline at the bottom, here's a simple illustration of the timeline for this study design, as well as the definitions for the short, medium, and long-term outcome. And this will be a cohort study comparing the cohorts with of subjects with a COVID-19 diagnosis and those without a COVID-19 diagnosis. And the outcomes we would like to investigate are the all-cause mortality, morbidities, including but not limited to neurological, cardiovascular, respiratory, hepatic, and renal, immunological diseases, and also malignancy. And in terms of the healthcare resources utilization, we will be focusing on the attendance of outpatient consultation visits, allied health visits, and A&E admission, 28 days hospital readmission, attendance of diagnostic tests, as well as the length of hospital stay per episode. In terms of our progress for this study, since we launched this study back in March, our colleagues in the HKU team, as well as the collaborators from the OHDSI, we have reviewed previous studies on COVID-19 conducted on the OHDSI platform. And using those information, we have identified several definitions for patients with COVID-19, which we may be able to adapt and apply to our current study. So at the moment, we are developing the cohort diagnostic package using those potential definitions of COVID-19 patients we have identified previously with the help of Gotham, which he's helping us on the more on the technical side in developing the cohort diagnostic package. And once we get the final version of the cohort diagnostic package, we will be able to send it out to our potential OHDSI collaborators for them to run on their on their own database. And once we've done that, we'll be able to decide and finalize on the definitions of a patient with COVID-19 for this particular study. So if you guys are interested in the definitions that we have identified from previous studies, here are the brief details for those cohort definitions. They were taken mainly from they were taken from the Charybdis study previously conducted, and also the AESI, which stands for Adverse Events of Special Interest within COVID-19 subjects, previously conducted on the OHDSI platform. So as I mentioned earlier, we will be sending out the cohort diagnostic package to anyone who may be interested in joining us for this study. So if you are interested in joining, but you haven't get in touch with us, then please do so. We would appreciate your interest, and we would like to work with you on that. And just an important note to let you guys know is that we there's quite an exhaustive list that of outcomes that I have presented, but we perfectly understand that your particular database might not contain all the information that we've put on the list, and it's okay. We would still be interested in working with you if you are interested in joining us for part of this study. So yeah, please feel free to get in touch with us if you may be interested in joining. And here is our contact details if you do wish to join us or want to get in touch with us. And that's a brief overview of our study and the current progress. So yeah, that's it from me for now. So thank you very much for listening. If you guys have any suggestions or questions, then yeah, I'll be happy to answer them. Thank you.
So I see Chen has a question. So
Chen?
Yeah.
Yeah, actually it's not questions. So we are in the discussion with Korean reimbursement, national reimbursement agency, which is HERA. And you may know that several previous OHDSI COVID-19 studies was conducted by using that database. And we are planning to convert some COVID-19 patient data and open that data to the international research again. It may start maybe from June or July this year. And there is a nationwide COVID-19 and nationwide national healthcare data. But there is no vaccine data at currently. We do not plan to integrate the vaccine data into that database. But in Korea, the vaccine COVID-19 vaccine was started from February 2021. So before that, February 2021, and no one has been vaccinated. I mean, so please note that. And unfortunately, I cannot use the CDM data of my institution because because of the security policy of this hospital, it is not the connection to the database of this institution is really unstable. So that's why I cannot conduct the Legend Diabetes package. I tried a lot, but it failed again, from the June this year, we will open the new data platform in this institution based on the AWS, and at the time I can conduct the Legend Diabetes package on my CDM instance. So that's the update, and you can there is a email address on the chat. So if you want to follow up more, please send the mail to me.
Yeah, thank you, Chan, for the information. We would definitely appreciate, yeah, if we may be able to work with you guys on, yeah, if possible. So, yeah.
Cool. Thank you, Ivan. And as Ivan just mentioned, so thank you, many thanks for Gossam, who is actually currently working on the current cohort diagnostic tool for the cohorts. And then we are actually gonna have him to talk about kind of the whole process of setting up the cohort diagnostic with the APAC community, just as a use case, so that we can all learn kind of how to get it done and use all of the great functionalities from the diagnostic tool. So that's also a preview for our next community call. So with that, any other questions on Hong Kong youth study from the audience? All right, cool. Thank you so much, Ivan. And then with, thank you. And then with that, I'm really sorry. We will be having Chungsoo from RG University to give us an update on the data quality study. So Chungsoo, would you like to start sharing your screen?
Okay, I'll share my screen. Could you see my screen now?
Yes, thank you.
Okay.
All good.
Hi, I'm Chungsoo Kim from RG University in Korea. I'll share the brief progress of the study 4, data quality of APAC study. As you know, we are planning to collect the CDM inspection reports from APAC collaborators. This is for checking our current status of CDM conversion and getting insights from the CDMs and improve our data quality. Finally, we are planning to disclose our status to other researchers who want to know about the basic statistics or status of each CDM. The package collects the record counts or person count and mapping rate of the current state. And in the case of drugs, detailed mapping information is also collected to check how mapping is performed in other databases. It would be, I think it would be one of the interesting things. We revised the CDM inspection packages slightly for the APAC folks and distributed already to study participants. And this is the example of results. Result is like that. We can show the basic statistics for each domain of CDM. And we can calculate the mapping completeness, or we can calculate the granularity of drug mappings, and we can decide what is the next priority of the vocabulary mapping, and we can collect the classical results, so we can compare, or we can discuss about this from each database. So far, we have a plan for running the CDM inspection package with 30 databases in the APAC region. Until now, we have obtained results for 21 EHRs in Korea already, and Japanese claim by IQVIA. Maybe I will write an abstract for the European OHDSI Symposium with this result. And personally, I think that this result sharing of APAC study based on the package, especially made in European OHDSI, is very interesting and important, and fits well with the collaborative spirit of OHDSI. So I would be nice if we could see it with the results of Europe. And so I'll write an abstract until next week, and I'll share the draft in our team's environment. And I'm also in contact with HERA, as mentioned by Chen before. They have a national claim data of all Korean population. So I want to, and I'm in contact with HERA now for collaborating with their national claim data with this CDM inspection package. So I think it could be, it can be, but yeah, I'm still in contact with them. And J&J is in the process of running package and calculating statistics for 2 APAC claims. One is the Japanese claim data, JMDC, I think, and one is the Australian's claim data. So I'm also discuss with Claire for this running the package, and the other EHRs are expected to be converted around this summer. So we will be carried out in the next quarter. So I hope the entire 30 or 31 database for the study package. And here is our timeline, especially our mini goal of this study is submit our abstract to European OHDSI Symposium. So we are planning them, and I'll write an abstract as soon as possible until the next week, and I share the draft to our colleagues. And is there anyone who are interested in this project? Please let me know, because I think this is the value of this study is collecting the more and more of the CDM inspection reports, because I think we can many insights from the reports from other databases or other institutions. So it would be help to improve our CDM data. Yeah. Thank you. And if you have any questions or comments, please let me know.
Thank you, Chusong. And great to see we do have a lot of results available now. Cool. Any other questions or comments from the audience?
So when you implement a CDM instance on your institutions, you may wonder how many records should be populated from the original data, or how complete the vocabulary mapping is kind of standard in this network. And I think the result of this study provides the benchmark profile of CDM, especially in APAC network, about the vocabulary mapping, or the quality, or the numbers of records per person, or per database. So it is really important, and one of the essential contribute of this OHDSI APAC network. Thanks, Chungsoo.
Thanks.
All right, cool. Thank you, Chungsoo. So that's the 3 study updates we have. And as mentioned earlier, so we do have another study from Nicole Pratt in Australia that unfortunately he will not, she's on leave and will not be sharing the study updates at a later time. Cool. So with that, that's all of the presentation we have today. If we have no more other questions, we are gonna give everyone 20 minutes back. Thank you so much for joining the call. Thank you, everyone.
Bye.
Have a good day. Bye.
Good day.